السلام عليكم. Basic life support. Basic life support is an important part of CPR. CPR, cardiopulmonary resuscitation, includes basic life support and advanced life support. We will discuss basic life support. Basic life support is the foundation for saving lives following cardiac arrest. It refers to maintaining airway patency, supporting breathing and circulation, without the use of equipment other than a protective device. Basic life support can be done for adults, pediatrics, and infants. This lecture we will discuss basic life support for adults. What are the causes of cardiac arrest? Just to remember 5 H's and 5 T's. Hypoxia, hypovolemia, hypothermia, hypo or hyperkalemia, hydrogen ions, mainly acidosis, tension pneumothorax, cardiac tamponade, toxins, thromboembolic pulmonary, and thromboembolic coronary. The American Heart Association, AHA, adult chain of survival. Either inside hospital or outside hospital, you have to rapidly recognize the arrest, start high-quality CPR as early as possible, use defibrillator when arrival, advanced life support, and post-cardiac arrest care is important. This chain of survival to improve the prognosis after cardiac arrest. Each minute counts, so time is life in basic life support. You have to start basic life support within 10 seconds of arrest for good prognosis. This is the algorithm of AHA for basic life support. We will discuss each item soon. The first step in the algorithm of basic life support ensures safety for the rescuer and the victim, and the rescuer is important than the victim because he will do the basic life support steps. So the first step is check safety. Second step, immediate recognition of cardiac arrest based on assessing unresponsiveness. Check response. Are you okay? Check and shout. Are you okay? And the result. If the victim is responsive, check for injuries. Reassess the victim and get help. Not responsive. Shout for help. Activate the emergency response system and get the AED. Get help. Then check for circulation and breathing simultaneously at the same time, 5 to 10 seconds. Not less than 5 seconds, not more than 10 seconds. After the APC now change it to CAP, Airway, breathing, circulation. Now the circulation is the first. Compressions are the first step. C for compressions, A for airway, P for breathing. This is the sequence of CAP. What about the C? Assess the circulation. Check the carotid pulse at least 5 seconds, but not more than 10 seconds. How can I assess the carotid pulse? While the patient is in the supine position, put your index and middle finger in the groove between the trachea and the sternocleidomastoid muscle under the lower jaw, and you can check for carotid pulse. Not less than 5 seconds, not more than 10 seconds. Is circulation present? If yes, continue for rescue breathing. Is there breathing or no? And reassess for signs of circulation every 2 minutes. Circulation. Perform 5 cycles of compressions and breath, a ratio of 30 to 2, starting with chest compression. 30 compressions and 2 breaths is 1 cycle. Each 5 cycles about 2 minutes. How to do these compressions? Identify the hand position on the sternum. Put your heel of the hand over the lower half of the sternum. Your elbows must be extended and you are vertical over the victim. Start chest compression for the anterior chest wall and depress the sternum at least 2 inches, at least 5 centimeters, and do 30 compressions in a rate of 100 to 120 compressions per minute. This is the right position for doing compression. And allow complete chest recoil between compressions. The victim must lie over a hard horizontal object. The next step is A, airway. We need a patent airway. As you know, the most common cause of oral cavity obstruction is the tongue. So we have to move the tongue away from the posterior pharyngeal wall to open the upper airway in an unresponsive victim. This is the technique of head tilt, chin lift. Head tilt, chin lift. Head tilt, chin lift can open the airway and getting the tongue away from the posterior pharyngeal wall. But if cervical spine injury is suspected, you can do jaw thrust. Maneuver. If a spinal injury is suspected, cervical trauma, or when head tilt chin lift doesn't work. You can move the lower jaw without moving the neck. It will open the airway. So, airway can be opened either by head tilt, chin lift, or jaw thrust. The P is breathing. Is the victim breathe or no? Yes, the victim can breathe. If safe, use the recovery position and reassess breathing and circulation every 2 minutes. Recovery position: raise the arm of the victim above his head. The other arm under the jaw. Leg flexed at knee and hip joints. Then move the patient or the victim you to stay over his leg and arm will be supported, and the other arm supporting the head, making the airway patent, and recheck or reassess every 2 minutes for breathing and pulse simultaneously 5 to 10 seconds. But if no breathing, give 2 effective rescue breaths. Deliver each rescue breath over 1 second and chest rise must occur. The rescue breath either by pocket mask or mouth to mouth. The pocket you can use it from the nasal bridge to the chin. Use the correct size of the pocket mask. Seal the pocket mask against the face. Give 2 breaths, each of 1 second, with visible chest rise. Keep your eyes on the chest. Airway breath in contains 21% oxygen, while airway breath out contains 17% of oxygen. So the victim will take enough oxygen. Mouth-to-mouth breathing or rescue breath. First, occlude the victim's nose and maintain chin lift. Take a breath, a regular breath, and ensure a good mouth-to-mouth sealing to avoid leak of air around the mouth. Blow steady for 1 second into the victim's mouth and watch the chest rise. Maintain chin lift, remove mouth, and watch the chest recoil or chest fall. You have to watch for chest recoil. So now the air is out from the victim's chest. A summary for high quality CPR. If you want to do high quality CPR for effective resuscitation, start compressions within 10 seconds of recognition of cardiac arrest. Push hard and push fast. Push hard at least 5 centimeters or at least 2 inches. Push fast, rate of compressions of 100 to 120 compressions per minute. Allow complete chest recoil after each compression. Minimize interruptions. For any interruption not more than 10 seconds during resuscitation. Give effective press and avoid excessive ventilation. When rescuer CPR, the cycle includes 30 compressions and 2 breaths. Each 5 cycles about 2 minutes. Each 2 minutes you have to reassess the victim's pulse and respiration for 5 to 10 seconds. If 2 rescuers, the same ratio, 30 compressions and 2 breaths. So for adults, the compression press ratios are 30 and 2 for 1 rescuer or 2 rescuers compression rate. During compression over the lower half of the sternum, you compress the heart and the venous return and intrathoracic pressures will change and move. Blood will go to the vital organs, especially the brain and the coronary vessels around the heart. If you do high quality chest compression, only the cardiac output will be 25 to 30% from the usual of this patient. So you have to do high quality CPR as much as you can. When to stop basic life support? It's a good question. You can continue resuscitation until the victim shows signs of life or you became too exhausted and the victim shows no signs of life. When qualified help arrives and takes over, or increased risk at the skin of basic life support. So you have to stop basic life support. Mouth-to-nose ventilation. If mouth-to-mouth technically difficult, you can do mouth-to-nose ventilation. If mouse is seriously injured, rescue from water or resuscitation carried out by a child or for aesthetic reasons, you can close the mouth and of the victim and use your mouth to the victim's nose ventilation. Another point is the compression-only CPR. Compression-only CPR, if there is a reluctance to perform mouth-to-mouth ventilation or chest compressions alone is better than no CPR. If possible, combine chest compressions with head tilt. It's appropriate for telephone CPR. When the person knows nothing about CPR, he can do only compressions by telephone. If 2 rescuers doing basic life support or more rescuers doing basic life support, you have to know about the AED device and the bag mask device. AED, automated external defibrillator. Automated external defibrillator is a device. You have to use it as soon as possible. So use AED on arrival and follow the AED prompts. The AED has a universal steps. Whatever the manufacturer, whatever the type, but the same steps. The first step, turn on the AED, power on. Second step, attach pads to the victim's bare chest according to the diagram over the pads, one over the apex, left side to the sternum, and the second right to the sternum under the right collarbone. The third step is stop compressions and wait for analysis of the rhythm. Fourth step, if the AED analyzes the rhythm and the rhythm now is shockable, the AED will charge for a shock and you can deliver shock by yourself. If no shock is needed, the AED will tell you to continue CPR if needed. So you have to recheck the pulse and respiration. If no pulse or breathing, start CPR again. If shock was advised, immediately after shock, continue CPR for 2 minutes, starting by chest compression. And now you can use the bag mask ventilation instead of pocket mask for getting breath. One rescuer for chest compression and the other rescuer for the bag mask ventilation. AED can be used for adult, children, or infants, but with children and infants, dose attenuator is used with these pads to decrease the dose of shock if needed. Chest compression is an important part of resuscitation. Don't delay resuscitation, don't delay compressions, and you can use AED and the other rescue dual compression. Stop compressions to analyze the rhythm or getting shock. The back mask device, you can use the mask and bag instead of your mouth. One hand technique, the hand holding the mask, you can form the CE clamp. The thumb and index finger like a C over the mask, while the other fingers doing E over the lower jaw. So the fit of mask and the extension of the head can be done by one hand, and the other hand squeezing the bag to get oxygen inside the chest. Two-hand technique. One rescuer doing the fixing the mask and getting the extension of the head, while another rescuer squeezing the bag. A team concept is one important item in the AHA guidelines. Basic life support can be done by one rescuer, two rescuers. If more than two rescuers, now it is a team, the ideal team of 6, one leader and 5 members. But if more than 2, rescuers. It's a team now. This is the basic life support adult cardiac arrest algorithm. We discussed the items. The first is safety, second, chest check response, and activate the emergency response system, check for pulse and breathing, and use AED on arrival, if shockable, if no shockable, and continue every 2 minutes to reassess, and so on. This is a diagram for the difference between adult children and infants for more information if you like. If you have any questions, please contact us anytime. University Resuscitation Center, Faculty of Medicine, we have the AHA courses. We provide the basic life support and healthcare provider courses in Arabic and English. If you need more information, contact us. Thank you.